Most of our clients gets what's called SPECT imaging. And so I'm going to talk to you a little bit about that and why I believe it's incredibly important. I realize SPECT imaging is still very controversial, and I realize that not everybody can do it, but when they can do it, I believe that this makes a really, really big difference in people's lives. And I believe that it's a procedure that's eventually going to be very, very helpful. So up to date, there's been about 80,000 SPECT images done by the Amen Clinic. And it's like, well, do you have to get a SPECT image? I mean, can't a psychiatrist figure it out? The answer is yes. I have talked to really good psychiatrists who said, absolutely, we can figure it out, but you can't do that in a 15-minute visit. And that's what's happening is, again, when you get a SPECT image, it's one day to get the image, and it's an hour-and-a-half history-taking event. The second day you get a concentration, what's called a concentration SPECT image, and the third day you meet with the psychiatrist for 2 hours. Yeah, so it's pretty intensive. So when you walk out of that particular session, you have a treatment plan that's absolutely comprehensive. So that being said, this is what a normal brain looks like on a SPECT image. And that's what alcohol abuse looks like. So if people tell you that, yeah, you know, a little alcohol doesn't hurt you, I can pretty much tell you that that does. And what that shows right there is lack of blood flow. Okay, this isn't something where your brain is just rotted out, but this is actually lack of blood flow. This is the normal undersurface of a brain. Okay, so we're going to go back. We're going to see nice and smooth. This looks great, right? Not so good. Normal. Smoking. So that whole thing about smoking's not good for your heart, yeah, it's not good for your brain either. Now there's depression. Now that up there at the top that you're looking at is your prefrontal cortex. That's that nice gray stuff behind your eyebrows. Now I want you to know that that prefrontal cortex is your insight, your hindsight, and your foresight. And I'm going to be talking to you some about this. So when you have clients that are impulsive, compulsive, doing those kinds of strange behaviors that you've talked to them over and over again, it's because, again, no prefrontal cortex. What we know now is that most men don't develop their prefrontal cortex until they're 28. Most women, it's 26. So do people know the difference between right and wrong? Probably. Can they implement the difference between right and wrong? Yeah, that's a little different. And if you don't have any blood flow to this part of your brain, do you really think that people can make the right choice? That's bipolar disorder. We call that the ring of fire. So one of the things that SPECT images show is it shows where your brain is too hot, where it's overactive, where it needs to be calmed down, and it shows where there's little activity. And we use medication to turn on the activity that needs to be turned on and turn off the activity that's too much. That's methamphetamine. So you can see, again, all those areas of the brain that are affected. Again, that prefrontal cortex up here, look at this big chunk that's missing right here in the front. See, it's supposed to be smooth right there, and it's not. Yes?
For example, on the depression brain, is that when you're actively in a depressive episode?
Yes. No, that's when you're in a depressive episode. My understanding is that this person actually came in because, of course, they couldn't get on the right medication. Tried it. And what usually happens is people go through a series of SSRIs because they're extraordinarily popular. They try one, then they try another one. And it's not that that's wrong, but after about 5 years, people either kill themselves or they give up and they stop taking anything because they couldn't get it right. Again, part of what's happening is, we'll talk a little bit at DBT about behaviorally shaping clients, and pretty soon they feel like failures and they quite frankly just give up going. There's a lot of depression medication out there that works. Some of them are MAOI inhibitors and that kind of thing. But again, it's taking a look and it's getting a thorough history, and it's not changing doctors. Clients are really bad about changing doctors after things don't work. So it's very difficult to behaviorally shape them to continue to go forward. So that's methamphetamine. So again, some bizarre behaviors here, lots of times with meth. Impulsive, compulsive.